Hello everyone, this is Dr. Aditya. Now, this video, let's start with how do you prepare, like an in-depth discussion about how do you prepare for November INI-CET. The first question I really want to ask you guys is that should you prepare for INI-CET? Before we get into the how of it, should you? Alright. So if you think you're getting a good rank in NEET PG or top 1000, top 5000 kind of a rank, even up to top 10,000 kind of a rank, I would say that, if you want to take a break, why do you want to prepare for November INI-CET? That's perfectly fine. The pressure gets to you, burnout is real. If you want to take a break, enjoy the life for the next 2-3 months before residency hits you, it's perfectly fine. Please take a break. There's no need to prepare for INI-CET. That's perfectly fine. No matter what any coaching tells you, you can take a break. And people who are from slightly lower ranks and you might not be getting the desired branch, for example, you're between 10 to 30,000, or 10 to 50,000. You might be getting your desired branch. For example, if you think surgery is your desired branch or anesthesia is your desired branch, you still get it at those ranks. But if you still want to give INI a shot, sure, prepare. If you feel like, no, I'm done, ho gaya jitni padhai honi thi, thak chuka hu, I'm tired, again, that's perfectly fine. Second thing I want to talk about is that don't think of INI-CET as unrealistic. A lot of people don't prepare for INI-CET simply because they think it's unrealistic, they can't improve. No. Let's be very hopeful. I've taken interviews on my channel itself. This was a girl, Dr. Surbi. She's doing neurosurgery at AIIMS Delhi right now. She got a 14,000 rank. Alright, obviously not a great rank. She wanted surgery, neurosurgery as far as her specialization is concerned. And then in 2 months, just 2 months, she from NEET PG to INI. This interview I took 2 years ago, right? She gave NEET PG 2023 in March, and in May, between 2 months, she converted that 14,000 rank into a 107 rank, and she's now doing neurosurgery at AIIMS. Alright. Similarly, another person, Dr. Rishi, he's doing anesthesia at AIIMS Delhi right now. He's a really good friend of mine. I love him, one of my favorite juniors. Surbi is also a very favorite junior of mine, having said that. Right? He also converted his 13,000 rank into a 1,000 rank. I always say this right now that whatever your rank is in NEET PG or whatever your expected rank is in NEET PG, you can remove 1 or 2 zeros. So see her, she went from 14,000 to 107. She removed 2 zeros. Right? Rishi, 13,000 to a 1200 rank, removed 1 zero. So 1 to 2 zero reduction is very easily possible. Alright, if you work hard, if you're dedicated over the next 3 months, nothing can stop you from removing 1 zero or 2 zero. So if you're supposed you're getting like a 15,000 rank, definitely a rank less than 1500 or less than 1000 in AIIMS or INI-CET is possible. It can open up, especially towards the end, towards the open counseling kind of round, it can open up a lot of opportunities for you as well, right? I know people who have gotten dermatology at 2000 rank in the open counseling, 4000 rank, they have gotten anesthesia, ophthalmology, seats like that in AIIMS Delhi, not in AIIMS Delhi, but in other AIIMS Bhopal, AIIMS Bhatinda, like that. So definitely give INI-CET, you can easily remove 1 or 2 zeros. Now, let's understand the difference between how NEET PG is made and how INI-CET is made. What are the fundamental differences? Let's start with the distribution of the paper. The fundamental difference in INI-CET, see, this is what I've done. In NEET PG, if you look at the first and second prof, it made up of 80 questions. That is 40% of your paper. That is 40% of your paper. Alright. While if you take INI-CET May this year, the INI-CET May, for example, 106. I would say even 110, that is 55% of your paper. Sometimes this goes as high as 60%. So majority of the paper is going to be first and second prof rather than being third and fourth prof. This is the fundamental difference that you have to understand. Even in that, if I go a little more integrity, anatomy particularly improves, increases in the weightage. You will just get 5, usually in NEET PG also you just get 5-6 questions on anatomy. This time there were 8, but INI-CET, it never happens that you get less than 15 questions as far as anatomy is concerned. The same goes as far as biochem is concerned. Biochem is very highly represented in INI-CET. Same goes for forensic medicine and pathology as well. All these things are asked much more frequently as far as INI-CET is concerned, and you can easily expect 55 to 60% of the paper being from first and second prof rather than being from final prof. So you cannot go into INI-CET with your first and second prof being underprepared. Alright, you cannot go into that with first and second prof being underprepared. Now, it also brings to the question, which are the subjects which are not that important. So I would say that ENT, usually in INI-CET, ENT will have 3 to 4 questions. It will have not more than 3 to 4 questions. While in NEET PG, it can always have 10 questions. This is what happened this time. 9 questions were there from it. Second thing I would say is, subjects like anesthesia or even for that matter radio, you can always do them with other subjects. Anesthesia 1 to 2 questions. Most of the questions are going to be from emergency, CPR and radio. You can always do it with surgery and medicine rather than thinking of it as an entire subject on its own. Alright, so this is as far as your difference, fundamental difference is concerned. Second fundamental difference INI-CET, even more than NEET PG. See, every paper has its own pet topics, the previous year questions and the previous year topics. INI-CET specifically focuses a lot on its core previous year topics, right? They have to ask one question on intention pneumothorax. They have to ask one question on Rett syndrome. They have to ask one question on, you know, hematology, the ALL prognostic factors like that. You know, they have to ask questions. They have GCS. They have their pet things. उन पे वो बार बार they keep on asking questions again and again on that. So if you are not familiar with the INI PYQs, you're not even in the race, right? So it's heavy on first and second prof, heavy on previous year question and previous year topic, especially the INI PYQs. If you look at this year's May 2024, 150 questions were modified PYQs. By modified PYQs, either they were verbatim repeats or just one or two words were changed here and there. And most of the questions were similar. वो वही चीज़ें बार बार पूछते हैं यार. Less than, I would say not more than 20 to 30 questions are new anytime. And as far as INI is concerned, even a 150, 160 correct gets you directly into a top 100 rank. As compared to NEET PG where 170 and 180 is what is required. But in INI, a top 150, 160 correct get you into a top 100 rank. Alright, 160 correct, 150, 160 correct gets you into a top 100 rank. Right? So this is my simple thing. Focus on INI PYQs. Especially the, and not just past 3, you know, whenever I talk about PYQs, लोग क्या करते हैं, सर 3 साल के PYQ कर लूँगा. यार, you guys have given NEET UG. तुम 3 साल के क्वेश्चन करके जाते थे. Did you used to do 3 year questions? Especially as far as the INI is concerned, I would recommend at least 7 to 10 years PYQs. At least 7 to 10 year PYQs. You have to do 7 to 10 year PYQs. Otherwise, you will not even be in the race. Alright. Now, how do you prepare? Now coming to how do you prepare for INI-CET? So this you have to do. This is a simple revision plan that I have made. आपको 10th of August, today's 10th of August, you have to start from 10th of August till 10th of October. And not 10th of October, I'll say till 5th of October also. You do one revision. Then another revision in the month of October. And then one last 7-day revision. On 9th, you will have your exam. Alright. Now, how do you go about on a daily basis? Subject-wise plan. Let's come to that. Alright. Coming to the subject-wise plan. You need to, and this goes without saying, yaar, mehnat karni padegi. I mean, you cannot crack an exam of stature of INI-CET if you don't put in 10 to 12 hours of daily studying. You have to do that. If you think you can crack INI by studying for 3-4 hours on a daily basis, no, it's not going to happen. If you're willing to put 1,000 hours, you know, I'm giving you a target right now. If you put in 1,000 hours, right? Daily 12 hours for the next 90 days. That is close to 1,000 hours, even more than 1,000 hours. But if you put 1,000 hours over the next 3 months, you will definitely make a tremendous improvement. Even if you, let's say, don't crack INI-CET, let me tell you, the improvement will propel you to get such a good rank in NEET PG 2026 that you will, be like, sure, great, this is good thing that I did. I put in these 1,000 hours here. All right. You need to do 10 to 12 hours of daily studying. There is no substitute for hard work. Now, coming to the first revision, how many days do you need to allocate to each subject? So this is a broad plan that I've made for you guys. You can take a screenshot of this. Anatomy 3 to 4 days. Basically the major subjects on 3 to 4 days. Surgery, OB/GYN, you can give a little higher days, 5 to 6 days, something like that. Medicine I've specifically done only 3 days. I'll tell you why. And I've not covered forensic here. I'll tell you why also. All right. And not cover radio also, by the way. Right. So 3 to 4 days. If you are confident in some subject, maybe you can complete it in 2.5 days also. Now, coming, what do you need to do in this first revision? What do you need to revise? Do you need a new source? The answer is no. Stick to your old notes. Most importantly, you have 2 months to revise. So, doesn't matter whether they are bulky, non-bulky, PTR, Marrow, Prep, Bhatia, DAMS, Doc Tutorials, Physics Wala, so many platforms, right? Doesn't matter. Alright, Arise, 6 और प्लेटफॉर्म के नाम बता दूंगा. Right? Doesn't matter. जो तुम्हारे notes हैं, whatever notes you have, you need to revise them only. नए पे नहीं जाना. TND, let's say you are taking a TND, so आप TND के अलग notes बनाओगे, but when you prepare for the 3 days of TND, आप अपने पुराने notes को ही revise करोगे. You are not going to go for new notes. You are going to revise your old notes only. Alright, you can easily revise whatever sets of notes that you have in 3 to 4 days for any subject. जो थोड़े weak है उनको 5 दे देना, जो थोड़े strong है, do it in 2. But this is a plan that I have made. This plan is of 53 days only, along with 1 week buffer. The important part of this 2-month revision is if you have some weak areas, like you, for example, you know that your pharmac is weak, then revise it over 6 days, yaar, 5 to 6 days. Maybe watch the main videos once. Ensure कि okay क्या मेरे conceptual lacking है और उनको ठीक करो. These 2 months are for the revision of the notes that you have already done for NEET PG, and at the same point of time, uh, taking care of your lacunas. These 2 months are for that. That's why you have good 2 months for revision. Enough, absolutely enough, right? If you think your opthal is weak, 3 की जगह 5 दिन ले लो. जो subject strong है, for example, if you think your biochem is or physio is strong, then why even 2 days? You can probably complete in 1.5 day the entire set of notes. 200 pages ही तो है, एक बार ही तो revise मारना है. That's what I'm going to do. So this is what the goal of this is. You will revise your own old notes and at the same point of time improve your concepts wherever you felt. You have given your NEET PG. You know तुम्हारी lacking कहाँ पर है. Improve on that lacking. All right. Maybe watch a video. Maybe solve two, 3 extra MCQs. Improve that. Okay. Day wise schedule कैसा होगा? For example, let's say you're going to go for path. तो 4 दिन path पे complete करनी है. So you make a day wise schedule. Today I'm going to revise general path properly. Next day I'm going to do hematology properly. Next day I'm going to divide systemic pathology into 2 parts. Part 1, part 2. Renal, CVS, recipe on one day, GIT, CNS or something on the next day. Like that. How do you go about daily? Daily 6 to 7 hours आप ना theory पढ़ोगे. 6 to 7 hours you will do theory and 3 hours you will do MCQ practice. 2 to 3 hours you will do MCQ practice. So that you at least study for 10 hours. I would advise you try to go till 12 hours, but 10 hours to daily पढ़ने हैं. 10 hours so definitely you have to study on a daily basis. Out of which 6 to 7 hours is of theory reading, revising what you have learned, and 2 to 3 hours of MCQ practice. Now coming to MCQ practice क्या करनी है? बहुत ही आसान है. INI PYQs करने हैं हमें. Right? अभी INI-CET PYQs कौन से करने हैं? Past 7 to 10 years के करने हैं. See 10-year papers, INI, 20 papers, 4,000 MCQs, not a small number. 4,000 MCQs you have to do. What do you use for the source? You can use Reflex, you can use Marrow, whichever QBank you have. If you have Prep Ladder, you can use that. I would, especially in this last 3 months, I would recommend Reflex. मैंने खुद आप बनाई थी, इसी पर्पस के लिए बनाई थी. नाम Reflex क्यों है? ताकि देखो explanations in Reflex are a little conciser as compared to Marrow and other platform. The reason is simple. Especially so that in the last 3 to 6 months, the revision becomes easier and easier, right? एक और added advantage है, तुम्हें topic wise PYQs मिल जाएंगे, right? तुम्हें you don't have to एक subject complete करके तुम्हें PYQs नहीं करने, तुम topic wise कर सकते हो कि आज मैंने general path की, for example, let's say, I've done आज मैंने जनरल माइक्रोबायोलॉजी इम्यूनोलॉजी की, आज मैं ये वाले कर लूँगा सिर्फ MCQs. मैंने अगले दिन बैक्टीरियो की, मैं सिर्फ बैक्टीरियो के MCQs कर लूँगा. सो दैट इज अनदर इंपॉर्टेंस. इवन इफ यू लाइक नहीं, आई वांट टू स्टिक टू मैरो या आई वांट टू स्टिक टू प्रेप लैडर जो मेरा पुराना QBank का सोर्स था, स्टिक टू दैट इज परफेक्टली फाइन. स्टिल आई वुड रिकमेंड रिफ्लेक्स कर लेना, बिकॉज ले लेना फॉर 3 year पेपर्स, 2014, 15, 16 के पेपर्स. दीज 6 पेपर्स, ट्रस्ट मी, दे गिव देम एज GTs. गिव देम एज GTs. इस बार from these 3 papers, these 600 MCQs, there were 20 to 30 verbatim repeats. So they definitely give you an edge. This 14, 15, 16 papers will definitely give you an edge. There is no denying that. There's absolutely. Give them as GTs. कि मैं इनको GTs देके, every 2-3 weeks मेरे को GTs देने हैं, तो मैं उनको GTs देके दे सकता हूँ. If not anything else. Plus Synapse, Reflex is very cheap. Usually the plan is just 1,000 rupees. If you use the code RESTART right now, because you're restarting your preparation, you can get it only for 700 rupees. That's a 330% discount we are giving for a 6 months and 1 year plan. You can get it for just 700 rupees. You can just get it for 700 rupees. That's about it. All right. Along with that, in Reflex, we are going to give you 3 more INI GTs, right? You'll get 3 more INI based GTs जो PYQs को just modify करके देंगे so that you can prepare for INI specifically over the next 3 months. 3 और INI GTs भी देंगे. I think that's pretty value for money, I would say. Now coming to what should be the goal of this 2 months. तो आपने सारे subjects किए, you kept on doing all these things, right? Now, अगर तुम, let's say you were revising using your main notes, you did path over 4 days using main notes, or let's say you were using rapid revision notes which you can revise faster. If you're using main notes, your goal should be that using these INI-CET PYQs, you'll get to know what are the important topics, right? What are the INI favorite topics? Trim down those notes, all right? Cut. Okay, this is not important, this is not important, this is not important, this is not important. If you're using rapid revision notes, you will feel them, they will be a little inadequate. So whatever topics you feel are inadequate in rapid revision notes, add the PYQ explanation. Maybe have a small another notebook, but add the PYQ explanation, the INI-CET PYQ explanations. All right, that should be done. Okay, that should be done. Now, especially as far as medicine is concerned, I would say there are 3 main focus areas of medicine because people struggle with medicine. You would have realized that, I have given medicine only 3 days. There's a reason I've given medicine only 3 days instead of giving 5 to 6 like obs, gynae and surgery. In medicine, you have to understand that core medicine has not been asked in INI-CET for the past 7 to 10 years. All right, what they usually ask, especially in the November exam is geared from an intern point of view. Okay, because that's when the AIMS interns first time give the exam. So they will ask more of emergencies, they will ask more of procedures, they will ask of ABG, ECG, they will ask infections. But the core medicine is characteristically not asked as far as INI-CET is concerned, especially the November one. Definitely there is a trend, they don't ask this. All right. So they won't ask you are Parkinson's, they won't ask you asthma. What they instead would ask you is acute severe asthma, status asthmaticus. They will ask you stroke syndromes. All right. So emergency aspect of anything should be focused upon, and that's how you can, if you do your path and pharma properly, the first and second the path pharma properly, you can actually complete medicine in 2 to 3 days, and that will save you a lot of time. And this is my recommendation. I give this recommendation always. Make your path pharma micro strong, automatically medicine gets done, and focus on the core areas of medicine rather than doing the entire medicine and thinking revise nahi hoga and stuff like that, right? Stick to the core, those medicine topics like emergencies, infection, ABG, ECG, from which maximum questions are asked. All right. Same goes for peds also, right? Even systemic peds. I'm a pediatrics. I always say this. Focus on general and neonatology. Don't focus on systemic pediatrics, barring few topics, maybe like cystic fibrosis, congenital heart diseases. But other topics are covered in path pharma properly. As far as FMT is concerned, if you look again here at the schedule, I had not given FMT. The reason I had not given FMT is this is something which I really want to tell. This is something which I did. You can also incorporate as far as your preparation is concerned. FMT is a very easy subject in the sense it doesn't require too much effort. So let's say towards the end of the day or midpoint, you're not in a position there where you can do like kind of heavy studying, right? Let's say you're studying surgery, it gets heavy after a point of time. So what I used to do was कि उस समय जब भी मैं ऐसे I used to feel थोड़ा frustrated and everything, मैं forensic उठा लेता था. मैं notes होंगे whatever notes तो I used to pick up forensic. Now forensic is very interesting. It's very light read. आराम से पढ़ो आराम से टॉक्सिक को पढ़ो sexual exploitation and all that those crimes how the भेजा कैसे उड़ाते हैं and all that forensic is interesting. Everyone wants to be Saluk. Do 30-40 minutes of passive reading, whatever topic you did, write notes or do PYQs, and slowly and steadily over the next 2 months तुम्हारे forensic notes automatically on a daily basis get made. This serves like a buffer when you're not in a mood to study. I would say forensic serves as a buffer. You can keep some other subject like this also. I think anesthesia can also be kept something like that. All right. Radio can be kept like that. This kind of buffer subjects which basically you use whenever you are not feeling the mood to study, and they're not forensics basically because it's a big subject as far as INI-CET is concerned. I find it to be a perfect buffer subject. Same goes for radio, like I said. Anytime you're doing the subject, surgery wali radio ki kar li, medicine wali kar li, OBG wali kar li, like that. All right. Now, especially as far as planning this is concerned, so I gave you a timeline for every subject, 2-3 days, 3-4 days, whatever it is. Stick to that. But how do you go about it? See, every one of you will have a strong subject, everyone will have a weak subject. Alright. Don't do all the strong subjects together. Don't do all the weak subjects together. It should be like I did a strong subject, medium subject, weak subject, again a strong subject, like that. It should never be that, let's say your path is strong, then it should be followed by biochem, which is weak, then ortho, which is like moderate, then OBG, which is again strong, like that. It shouldn't happen that you did biochem, pharma, both are weak, I did them together. You lose all the confidence. And don't do 2 strong subjects together also, you'll get false confidence. So modulate your subjects like this and you will always, 3 months, 3 महीने की तो बात है, you'll at least feel motivated. Coming to MCQ practice, I told you on a daily basis you have to do 2-3 hours of INI-CET previous year question that you have to do, there's no denying that. Along with that, give 1 GT every week. I would actually recommend that giving all the previous year papers of INI as GTs is a very recommended strategy. That every week you give 2 past previous year papers of INI as GTs. That's the best thing that you can do. Even if you don't give anything else, but give them as GTs. Don't give them कि मैं ऐसे मजे में ना, a lot of people give GTs like over a period of 2 days, 1.5 day, but like that. Give it seriously. Give 2 GTs every week. Use the previous year papers of INI as GTs. Nothing can stop you from getting a good rank. Even if you do the past 7 years, 10 years papers properly, still you will get a good rank. By a good rank, obviously not a rank which might get you a college, but it will definitely boost your confidence if November is still stepping towards the NEET PG 2026. Alright, if you want to give QBank GTs, give them once in 3 weeks. Okay, but every week give the past papers as 1 or 2 papers as GT. So by October 5th, October 8th, I would say, around about 60 days, 1 revision should be done. Even if 2-3 subjects are not left, move on to the next revision. Alright, in the second revision, now it should be the trimmed notes. Let's say you were using main notes, now you have trimmed them down using the PYQs, or if the bulkier notes of the RR, that part, you don't add anything new. Okay, last 1.5 month, you never add anything new. No new source, just whatever you have done, try to revise it. And then finally comes the last 7 to 9 day revision. Last 7 to 9 day revision, I would advise don't give a GT. Alright. For the last 7 to 9 day revision, last 7 to 10 day revision, I'll make a separate video. Don't worry about that. Okay. From some frequently asked questions, I would say that, sir, I did DAMs initially. Should I stick to those notes or should I make new notes? No, stick to your old notes. But like I said, trim them down using INI-CET PYQs right now. Same goes for DBMCI people. Trim them down using the INI-CET PYQs, 7 to 10 year PYQs. Let's say you were using Marrow or Prep Ladder. In that case, like I said, if you were using main notes for revision, trim them down. If you're using RR notes, bulk them up using the PYQ explanation. Should you use first aid? Yes. Should you use entire first aid? No. 3 months is too small a time for first aid. But specifically from INI-CET perspective, I'll recommend 3 subjects: micro, biochem, psychiatry. These 3 you can still do from first aid. How to use first aid, there are multiple videos I've already made. I'll again make a video in the coming days. Don't worry about it. Don't go for entire first aid 3 months prior to the exam. You should definitely, if you are someone that's preparing for NEET PG 2026, sure, go for the entire first aid. No doubt about that. Alright. So this has been an extensive video where I've covered everything in depth. Alright. If you have any further questions, please write in the comments. I'll try to answer them in the coming videos. I will make videos on the last 7-10 day revision. I will make videos on further refinement of the strategy, main notes versus RRs kind of ones. I'll make notes on individual subjects, some important individual subjects on how to complete them. For example, pediatrics also. That's it from my side today. Thank you and have a nice day.